My name is Benedict Inosekafo, and we are going to carry out a brief description and a practical session on how to carry out ear syringing, also known as ear irrigation. Okay, so ear syringing or ear irrigation is a clean procedure to remove foreign bodies from the ear. Okay, the foreign body may be objects such as beans, beads that can be easily inserted into the ear by children, or it can be a procedure to remove wires. When we say ear wires, also known as ear cerumen. Okay, to remove any cerumen impaction from the ear. Okay, so if you look at the trolley here, it contains all the equipment needed to carry out ear syringing. Okay, so we are going to identify the instruments and what they are used for. First, you have your normal saline. The normal saline is the solution you want to use to irrigate the ear. Okay, in a situation where there is no normal saline, you can use a clean water that is warm to the body temperature. We have to use a tepid water. Okay, the basic purpose or the rationale for using a tepid water is to ensure that the patient is comfortable. Okay, if you are using water that is too hot, it may cause damage to the auricle of the ear and even to the tympanic membrane. But if you are using water that is cold, it may cause irritation of the tympanic membrane, and that can lead to dizziness of the patient. Okay, so dizziness to the patient. So that is why you don't use cold water. All what you need to use is a tepid water. In other words, a water that is as hot as 35 to 36 centigrade. Okay, the syringe itself, which you upload the normal saline into for the procedure. Then you have your ear drop, because sometimes immediately after the procedure you have to install some ear drop. Okay, this is a gentamicin ear drop, which you have to install into the ear to prevent infection. Then you have your receiver. This receiver is basically for receiving used swab. Okay, then you have your large kidney dish. The large kidney dish is, you put it at the underneath the auricle of the ear to receive the waste that will be coming out from the ear. Then we have a small kidney dish that contains forceps and scissors. Okay, then we also have your glove there, and we also have a dry swab to clean the patient body and ear after the procedure. And then we also have the towel that you put on the shoulder of the patient, so that the clothes of the patient will not be wet with water. And again, we have the cannula. The cannula, what do you do with the cannula? You open the cannula, you remove the needle, then you insert the tip of the cannula to the syringe, so that you can apply it to the ear for the syringing. So we are going to start the procedure. Okay, so the first thing you do when you want to carry out procedure is to explain the procedure to the patient, so that the patient will know what to expect and how to cope during the procedure. Okay, so I'm going to explain the procedure now. Mrs. St. John, good morning, how are you doing? Okay, so we want to carry out ear syringing for your right ear. Okay, we examine the ear and we notice that there is ear wires inside the ear. So the ear syringing, we are going to get some water. We put it close to your ear and pump it inside your ear to enable the water to remove the ear wax. And that procedure will not take us more than 5 to 10 minutes. Are we permitted to carry out the procedure? Good. So you see that I've taken consent for the patient, and the patient have been able to give me a reply that the procedure should be carried. So the first thing I will do is to drip my patient. Put this on the shoulder of the patient. The purpose of this towel is to prevent water that will be coming out from the ear from wetting the patient clothes. Then the next thing you need to do is to assess the ear itself. You assess the ear. You want to see, okay, the nature of the auricle. Then you check the ear itself, the canal, and see the nature of the impaction. Okay. For adults, one way to check the ear is to raise the ear up, the auricle up, then you move it backward. Then you can easily visualize the ear. Okay. After assessing or inspecting the ear, the next thing for you to do is to remove the cap of the normal saline. In this procedure, I'm going to use normal saline. Okay, this normal saline has been warmed to 37 degrees. Now, what I need to do is to take the scissors, then I open the normal saline. Okay, then after that, I can don my glove. When you don your glove, after doing your glove, then the next thing for you to do is to open the syringe itself. So to open the syringe, you don't just burst the syringe as locally done. The best way is to look for the edge of the syringe, look for the edge and open in a way that you can get the syringe at a cut and connecting the syringe itself. Okay? When you dig out the syringe, then this is your waste container you put. Okay? You put your waste here. After you open the syringe, then use the cannula. To use the cannula, you need to open it, then bring out the cannula itself. When you bring out the cannula itself, you need to remove the needle. It's very necessary. This is the needle. You don't need this needle. This cannula is the cannula you usually use to do intravenous insertion. So, but for this procedure, we don't need the needle. You drop the needle here. Then, this is the tip that we need for this procedure. So, to get the infusion, the normal saline, you just go in there, you take the normal saline, good, you take the normal saline, then after you take the normal saline, you fist it straight here. Now, you move straight to the patient. You can give the patient the receiving kidney dish to hold close to the ear. As I said before, the function of this receiving kidney dish is to receive any water that will be coming out from the patient's ear. Water and any wax coming out or any debris, foreign body coming out. But one thing you need to know before carrying out ear syringing is this. The nature of foreign body inside determines the solution you want to use in most cases. If it's something like big that cannot absorb water, then you can use your normal saline or a clean water that is warm to about 37 degrees. You know, that would be a tempered water. Okay, but if it's just ear wax too, you can decide to use mineral oil to install mineral oil inside the ear for about 30 minutes. That will help the syringing process to be easy in removing the was impassion. Okay, so in this procedure, immediately you put the kidney dish straight to the head side of the patient, which is the underneath the ear or the auricle of the ear. Now you open all the auricle of the ear. Your syringe needs to come close to the wall of the ear. You don't need to send this tip straight inside the ear. If you do that, you will damage the tympanic membrane. Okay, so you need to put it at the side of the ear canal, just at the side. Then you tell the patient that you want to pump. You send in the solution in. As you are sending in the solution in, the particles or any earwax will continue to go out. If it's a foreign body like a bead, it may take you 3 or 4 syringing process to bring it out. Okay, so if you push the first one and the foreign body is still in, you continue to push it at the side, put it at the side of the wall of the ear canal. Then you continue to push. You send it in gradually. You are not using too strong pressure. If you are using too much pressure, the pressure may damage the tympanic membrane. Okay, so you use a moderate pressure. Whatsoever is inside, when the water hits the tympanic membrane, it will force the foreign object that's inside to lose outside to the external part of the auricle, where you can see the particles, and use this faucet to remove the particles. Okay, so that is simple ear syringing. Okay, if the particles or the foreign body that is inside is not out, you continue the procedure till the foreign body is out. And the moment the foreign body is out, you remove the kidney tins that contain the dirty water and the foreign particles. Okay, you put it at the lower part of the trolley. Then you return the syringe and the cannula back to the kidney dish. You use the cotton wound swab to clean the patient. Okay, clean the patient. Then you have to also clean the auricle of the ear. Okay, when you finish cleaning the patient and auricle of the ear, okay, you can equally install any antibiotics. Okay, ear drop, anyone that is prescribed. Okay, if it's prescribed, then you open and install it into the auricle, okay, into the ear per se. Then after doing that, you remove the drip towel from the patient. Okay, then you explain what was removed, what was seen, you explain to the patient. Then you document whatsoever you use for the procedure, and what the nature of the foreign body that was removed. You also you document it. When you document it, then you can make your patient comfortable. That's end the ear irrigation, also known as ear syringing. But one thing you need to know is that if it's something like beans that the baby inserted into the ear, if you use normal saline or water solution and that foreign body, in this case beans, fails to remove immediately, the beans may absorb the water, and when it absorbs the water, the size of the beans will increase, and that will cause more pain to the patient. So it is advised that you use solution that cannot be absorbed by the beans. In this case, you can use olive oil, okay, to irrigate the ear. So because the olive oil cannot be absorbed by the beans, okay. But if it's something that is cannot be absorbed, cannot absorb water, maybe like beads, stone, cotton, even if cotton absorb water, it cannot increase in size. Or if there is any drainage from the ear, okay, you can also carry out the ear syringe using normal saline. But the contraindication for ear syringing that is, when we say contraindication, simply means that situation or condition where you cannot carry out ear syringing. One of it is when there is perforation of the ear. Okay, if there is perforation of the ear, you cannot carry out ear syringing, because whatsoever that you are syringing will pass through the tympanic membrane into the middle part of the ear, and that will worsen the infection and can also cause dizziness for the patient. Okay, so when there is tympanic membrane perforation, you don't need to carry out ear syringing using water for that kind of patient. Okay, another situation where you cannot carry out ear syringing is when the patient did not consent to that. It's very, very vital. If the patient said no, you can't do ear syringing for me, then you cannot carry out ear syringing for that kind of patient. Okay, but basically ear syringing is not a difficult procedure. It's an easy procedure that you can carry out to remove foreign bodies from the ear. So with that, we say thank you. Then you return all the instruments, you clear the place, take them to their appropriate location. The one that need to be discarded, you discard it. You document your finding. That's end the procedure. Thank you.